And so you were very flexible, right?
Hmm.
At the time, and you had joints that would dislocate a lot. That's what was
Yeah.
happening with that.
So I haven't had I'm still flexible, but I haven't had any dislocations at all, really. So
And awesome.
yeah,
That's great. How often were the joint dislocations? How often did you experience that?
it depended on the activity I was doing. If I was out walking the dog and he went after a squirrel, my shoulder would pop out because of the leash pulling. And then just everyday things, picking stuff up, it would just pop out sometimes. So probably it would depend on what I'm doing, but a few times a week to sometimes a couple times a day.
A couple times a day, and that was for the
My shoulders.
shoulders only. Was the knee pain always or only under in the past? Was it always or was it only under certain types of activity?
When I was standing or walking for a long time, mostly standing,
Mostly standing. How long did you stand for before you felt the knees hurt before?
a couple minutes.
A couple of minutes. And now you
I don't
can
feel it
stand
anymore.
at all. The knee pain
Yeah.
is gone. Pretty incredible.
Yeah.
Something else that you had was your POTS type of symptoms or POTS syndrome symptoms. Can you explain what those were like for you?
It would mostly affect me every time I stood up or even sat up from sitting or lying position. And then it was just like immediately all blurry. And my vision went totally, it was kind of gone. And then sometimes I would even fall over. I'd have to grab onto a chair or something and put my head down to get blood flow to my head so I wouldn't pass out. It was kind of like that every time I stood up. So
With the elevated heart rate every time you stood up and the feeling of lightheaded and faint feeling and blurry vision and eyes blacking out, as you put it, how often was that happening? Was that every single time you stood up?
pretty much, especially if I was like lying down or sitting for a long time and I would stand up suddenly, then it would happen every time.
And how long were you feeling these POTS-like symptoms for?
Probably around 5 years.
Okay. How much relief from these POTS symptoms? On a percentage scale, if 100% is 100% relief or 50%,
95, I'd say.
95% better.
Yeah, I
And
can.
that's all after one protocol.
Mhm. Yeah.
Amazing. One of your other symptoms was you had cold feet, and those are better now.
Better. Yes. Probably about
Right.
60% better. I don't have cold feet right now.
Awesome. And that was every day and every night. So that's awesome.
Yeah.
You had also, one of your other symptoms was you had migraines. So even the light sensitivity and sound sensitivity, those are nearly gone.
Pretty
As well?
much. Yeah. I mean,
Yeah.
if I like look into go out in the sun with a headache, it'll hurt, but not to the same degree as what I was experiencing at all.
Incredible. Congratulations.
Thank you.
You're welcome. My pleasure. The hip pain you also had.
Hmm.
And you still have some hip pain after one protocol with me, but your hip
Mhm.
pain is still there yet. How much reduced is that hip pain from what it was before?
50% about.
Are you able to fall asleep now?
Yeah.
Easily
Better.
or easily?
Mhm.
And you're staying asleep more?
Hmm.
So one of the reasons why sleep is better is because the anxiety and the panic is no longer that much of a
Mhm.
problem for you, right?
Yeah.
How often now does the anxiety bother you?
Maybe once a week at night, but I can still get to sleep pretty quickly. So yeah.
And the severity of the anxiety is less than what it was. Is that what
Mhm.
that told us?
Yeah.
And the panic that used to be every night,
Yeah.
is
Definitely reduced.
and that is reduced to, you told me, one time every 2 months now.
Yeah.
So,
Mhm.
get that.
That's right.
Awesome.
Clearly it works. Of course, I was skeptical at first, but I mean, I did some research myself on frequency therapy and muscle testing, and it's a real thing and it does work. I think that other people should definitely try it.